I'm Jim Caridi. I'm Professor in Chief of Vascular and Interventional Radiology at the University of Florida, and I've been asked to speak about two systems: the c-mmander CO2 source in combination with a medical gas delivery system known as the AngiAssist. As you can see, as opposed to other gas delivery systems, it comes prepackaged, already assembled, and it requires absolutely no assembly, so it is much more user-friendly. When you take it out of the package, what you would like to do is have it so that the proprietary 60-degree K-valve is facing you. So when you look at this, as such, you have an afferent tubing which comes from the source and comes to the reservoir syringe. The reservoir syringe is then connected with a delivery syringe in which you have the efferent tubing which goes and delivers the source of gas. Normally we have a one-way valve here, so there can be no reflux back to the CO2 source or gas source, and we have another one-way valve here so that wherever this is hooked up cannot reflux back into the system. So when this is connected, the proprietary one-way 60-degree valve, there can never be distribution of gas from the afferent limb to the efferent limb, because the 60-degree valve prevents this. It can never be turned such that it is open to the system. When we discuss CO2 delivery, we don't like it connected directly to the CO2 source because there can be accidental infusion of carbon dioxide into the efferent limb. In this, using the proprietary valve, this cannot happen and is impossible. Delivery system, what it uses as a source of CO2 is a small canister of pharmacologic grade carbon dioxide, which is almost pure, and it contains 10,000 units of carbon dioxide. This is attached to the CO2 source, which is a low pressure delivery source. The PSI can be regulated, and which you can see here. And then what we do is we decide on a PSI. We usually keep it less than 10 PSI, otherwise you can have some problems with the plunger here, and keep a low pressure system. So again, the afferent limb with the one-way valve glued to the limb is connected. So then we just pulse in some CO2 as necessary into the repository syringe. And then again, if you want to purge, you can purge off what you think is excess. Don't want to do that. What you can do is then advance this plunger, taking the volume of CO2 that you want. Remember, it's been purged, so this is a fairly accurate volume. Then you turn to the efferent limb and deliver the volume of gas that you would like to deliver. Okay, so to recapitulate, we have a disposable CO2 canister with 10,000 cc's of carbon dioxide that's hooked up to the c-mmander CO2 source. That's a low pressure in which you can regulate the pressure that you want. Again, we like to keep it less than 10 psi. We have a proprietary K-valve which allows you to see the direction of flow at all times, and you can never go directly from the CO2 source to the efferent limb. So again, let's start this. Source is here. We then decide on the volume of CO2 we'd like to inject. Let's say we want to inject 20 cc's. Again, you can aspirate or infuse. And then we deliver our 20 cc's non-explosively through the efferent limb. The beauty of the c-mmander CO2 delivery source is that it's small and it's compact, and it can be sleeved and put in the sterile field, or it can be hung easily outside the sterile field. It's significantly easier to operate as it has no confusing tubing, bags, or stopcocks. This comes as is, already assembled. It does not require filling and removing the gas from a bag. It's impossible to hook up inappropriately, so you don't have to worry about contamination. It allows clear indication of the valve direction with the proprietary 60-degree valve, and you can never hook up from the CO2 source to the efferent limb. It is a closed system, so you don't have to worry about contamination. You have better control for the delivery of gas. Has a safety valve, K-valve, proprietary valve that will not allow the infusion or the accidental infusion of carbon dioxide. And the fact that it is so user-friendly precludes the fear factor for doing these procedures with other delivery systems. Thank you.